You're part of the rollout. How's it going?
Well, it's been very frustrating and very uncertain in general practice. General practices responded to a request to supply vaccinations through their clinics. Um, the number of vaccines provided per clinic varied. In our group, we have 6 practices. Our largest practice, which has over 8,000 eligible patients, full-time equivalent eligible patients, received 50 vaccinations. And our smallest practice received 50 vaccinations. Our second largest received 400. So we've got one practice where the 50 vaccinations on the current rollout will take 12 months to deliver probably, and the 400 we can do in a day. So we're using different models. It's challenging. We've spoken to the Commonwealth around different approaches. It's hard to get a response.
So let's just talk through that. How are those numbers happening? I mean, are you asking for different numbers amongst your different practices and just getting much different vaccines back? And what's the explanation for that when you say, no, you've got to adjust it, we need more here, we need fewer here?
Look, there's no clear explanation. We do understand that 3.8 million doses didn't arrive from overseas, the AstraZeneca vaccine. We understand that. But when we have a clinic that has a huge number of patients, our largest practice, it only gets 50 doses. And we spoke with a number of the practices in the area that are also large clinics, and they also only receive 50 doses. The tooling up for 50 doses is quite different to the tooling up for 400. So we have a problem where our patients are ringing up, flooding the phone lines, arguing with the receptionists. We can only offer 50 a week, and we do that in 3 hours, 2 hours. So what do we do for the rest of the week? Whereas in the 400 practice, what we decided to do was tool up on the weekend, and we run a clinic on Saturday and Sunday. We're doing 30 to 40 vaccinations there an hour in a very streamlined model, but that puts pressure on the practice as well. So we're only doing it on the weekend. Then we get a lot of new patients coming in because other practices in the area only got 50, so they don't have sufficient dose. And then we have to make a choice between vaccinating our patients and vaccinating the local community. And we're happy to do both, but you can't do them both with a limited supply of vaccinations.
So, I mean, it sounds like you've retooled everything around vaccinations for these practices that will be able to get more vaccines. Is the big issue here that the bigger practices in particular just can't get above a certain threshold of vaccines, and that's making all of this a very inefficient process?
Absolutely. So when we responded to the initial tender process, we were under the assumption that our larger practices would receive 400, as did most of my colleagues in the sector. But to only get 50 means you can actually do that in an afternoon. When you do 400, you've got quite an efficient process. So we've set up a arrivals lounge, a departure lounge. We've got 4 vaccinators working at any one time. But even then we run into a problem because the Medicare model for larger practices is not appropriate in the same way that it might work for a small practice of 50 with 1 or 2 GP owners. So we've employed hospital doctors, nurse vaccinators. We've got a whole team of people in the larger clinic working on the weekends. But the Medicare funding model is a fee-for-service model, which means if people don't turn up, we don't receive funding. It's a challenge. People do drop out because of the recent scares. We would prefer a direct funding model in the same way that a hospital gets direct funded, a block funding model, so that we can work out how to deliver the vaccines more efficiently. We need flexibility in the approach, and we have spoken to the Commonwealth Government, and we're struggling to get a response.
So it sounds as well, the government's been sort of boasting about how many GPs have signed up, 4,500 to this scheme, that you think there could be some value in not having so many, but bigger players in there, more bigger players. And even if that means somebody perhaps can't go to their GP, there'll be a better system for getting this vaccine rolled out?
Look, I'm a general practitioner. Under normal circumstances, I think it's extremely important that people see their regular GP, their regular practice for all their care, including vaccinations. That's how FluVax works. This is a little bit different. There are some practices who won't be able to tool up for the 50 or just find it logistically challenging, particularly if you have a small waiting room. We have in the waiting room on the way out on the weekend, sometimes 20 to 30 people, because they've got to wait for a minimum of 15 minutes. You've got to make sure there's no anaphylactic reaction. You've got to have teams tooled up to deal with that. Some practices just won't have that desire or capability. Others will. So larger practices may be able to do more if they've got the space. Smaller practices may choose to participate or not. But we also think alternative models, including the use of large stadiums, might be an option. A friend of mine on the weekend called me from Florida, And he said that he drove up to Tampa, an hour away from where he was living, drove into a Greyhound stadium, repurposed. It was run by the National Guard. He actually had a choice of the vaccine that he was administered. I don't know how he chose, and I'm not advocating that. He took the Janssen one, the J&J one, and he was out of there within an hour. Very efficient. I've had friends that have been to the Melbourne Convention Centre. They've lined up, they've waited. Very efficient. We think there are alternative models where you could bring GPs into collective hubs, working collaboratively with the local councils, the state government and the federal government and the primary health networks. But we're struggling to have those conversations.
We'll keep in touch as to how it's all going, but appreciate your time, Dr Nathan Pinskier. Thank you.
Thank you very much.